Hi, my name's Tammy. I'm a registered nurse with the BSN program here at Rowan University. Lisa's here to sit in for assessment of the mouth, nose, and ears. Lisa?
Hi, my name's Lisa Long and I consent to this assessment.
So, Lisa, my name's Tammy. I'll be assessing you today. Ears, nose, and throat, mouth. I'm going to wash my hands. Can you tell me if you have any history of respiratory infection?
No.
Postnasal drip?
No.
Have you ever had any injury to your nose, mouth, or ears?
No.
Any vertigo?
No.
Have you ever had a history of wax buildup or pain in your ears?
No.
Okay. And all of your teeth are intact?
Yes.
Any new cavities?
No.
And any soreness when you swallow?
No.
Okay. So first we're going to start off with the nose. And we see that the nose is midline. Her smile is symmetrical and tongue is midline. Tongue is nice and clear and pink. The nose is pliable. I'm going to check for patency in each nostril. And again, so we have paint in both nostrils. We're going to go ahead and take a look inside. What we're looking for inside of the nose is we're looking the septum. We're looking for the turbinate mucous membranes to check to see if there's any polyps or discharge. I don't see any discharge from afar. And I'm just going to go. So her membranes are nice and pink, intact. There are no palpable or visual polyps in the nose. Her septum is intact. I'm going to go ahead and look at the other side, lifting the nostril. And again, nice and pink. No polyps noticed. I don't see any postnasal drip inside of the nose. And it's pliable. Any pain in your nose when I palpate?
No.
The skin looks nice and intact on the nose as well. With the ear, we're checking for recoiling of the ear. Any pain in your ear when I tug on it?
No.
We perform a tug test looking to see if there's any discomfort in the ear canal, which would indicate that there may be an infection. So I'm going to pull up and back. Looking at the eardrum, we're looking for no plaque. Clear, no red or drainage, eardrum is intact. I'm going to go ahead to the other side, and again looking at the same things, assessing the eardrum for color, patency. Any pain when I tug on your ear?
Nope.
Okay. And the eardrum inside is plaque, intact, no drainage. Discharge, no redness, irritation. One of the other assessments that we do with the ear test is the Weber and Rinn. Starting with the Weber test, we're looking to see if the sound is symmetrical on both sides. This would indicate if there was any hearing impairment from side to side. Lisa, tell me where you hear this. Is it equal in both ears, or do you hear it on one side or the other?
It's equal on both ears.
Okay, which would be an indication that her hearing on either side is intact. The REM part of the test, so you hear ringing, let me know when the ringing stops.
Now?
And do you still hear a conduction of sound?
Yes.
Let me know when that stops.
Now?
Okay, so basically what that's showing us is that bone conduction is less than air conduction. So air conduction is greater than the bone conduction, and we demonstrate that by putting it on the bony of prominence behind the ear, and then when the sound diminishes, measuring the time between air conduction. And you would repeat that on the other side as well. And so the last test we're going to do for hearing would be the whisper test. If you can go ahead and occlude this ear closest to me and repeat what I say. One. Okay, and I'm going to demonstrate that on the other side as well. If you can include that. A.
A.
A. So that would be a positive indication. As we move down towards the lips, we've already checked that the smile symmetrical tongue is midline. Her tongue is nice and pink. We're looking at the lips for any type of drying or cracking, any history of herpes or canker sores in your mouth. And her lips are slightly dry but intact. There's no lesions or cracking noted. If you can go ahead and open your mouth, Lisa. So again, we're looking at the tongue, looking for any cracks, dryness, dehydration of any sort. Inside of the mouth, we're going to go ahead and visualize and auscultate. If I were to have a glove on, I would check for any type of canker sores, any redness, cracking, white lesions, or something that could be cancerous. Looking along the tongue line to make sure everything is intact. Lisa, if you can lift your tongue. We're looking at the mandible glands at the bottom, that they're both all intact. The frenulum is also intact. Her teeth are without decay. No, we have history of some cavities, but nothing current. We're also looking at the back of the throat for the hard palate and soft palate. Hard palate, you'll see some deviations in, sorry, I'm right in your eye with that. Some deviations for color and texture, and all of them are intact. Also, in the back of the mouth, we're looking at the uvulum, and tonsils are clear. That's midline. Go say ah.
Ah.
Okay. And that would just elevate it if we're having any difficulty seeing it in the back of the mouth. That's all for today's assessment. I thank you for your time, and have a good evening.